Mm. My name is David Gibson, and I'll be talking to you today about unconscious bias. This is week 15 assignment for my social work class at the UGA. Week 15, to be more specific, Dr. Singer is the professor. Um, Unconscious bias is a type of cognitive bias. It refers to the automatic judgments people make about others based on things they cannot help, race, gender, sexual orientation, and so on. These biases can influence how social workers act towards our patients and clients without realizing it, because they go against what we believe. For quick story, um, during a patient assessment, an older man came in with a younger woman. He looked disheveled, and she was dressed immaculately. And the social work intern I was working with, he assumed, because of the age difference and how he was looking, he assumed that he was his daughter, and he asked him as such. And the man gave him a nasty look and said, "No, that's his wife." So I've been talking about the article, Interventions to Mitigate Bias in Social Work Decision Making. It's a systematic review by Featherston and colleagues. Uh, The review explores different methods that help social workers reduce biases in their decision making. The goal to give professional tools that support fairness and ethical practice. The topic matters deeply because bias, especially when ignored, can hurt more than it helps. And the purpose of the evaluation is look how different tools and strategies can be used to reduce our own biases that we all have. And overview, the authors reviewed four different strategies. The first being back, the first being a nomogram tool, web-based training, a consideration of opposite approach, and a video education module. Since some theories vary in design and outcomes, the teams used a narrative summary instead of statistical analysis. And the participants were social workers, social work students, and other mental health professionals. And group sizes range from 15 to 600 people. And ethics and diversity, only one review studies addressed race or ethnicity. The authors acknowledged this as a limitation and recommended future research include more focus on cultural awareness and inequality. And what was found was the nomogram tool and web-based training showed potential in helping reduce bias, but a consideration of opposite opposite strategy, the consideration of opposite strategy was not effective, and the video-based education module was inconclusive. And here goes the tools that we're talking about. Feel free to pause while I introduce the slides, because so I want to introduce them here. And this is the data we was left with. As you can see, the blue is the effective side, the orange is the ineffective, and the gray one's inconclusive. And integration. While the study did not name ProSaid directly, some of its elements like planning and evaluation were clearly included. However, the review lacked focus on client empowerment or advocacy across systems, which was also key parts of ProSaid model. Evaluation frameworks. The authors used a standard systematic review. To improve future research, they suggested including anti-racist, anti-oppressive, and participatory approaches, and including feedback and voices from those that impacted most. Practice impact. This study supports the developmental tools and training to help social workers reduce bias. These findings can improve services in areas like child welfare value, healthcare, mental health by helping professionals make better and more respectful decisions. And in conclusion, Featherston and colleagues provide meaningful insight into how we can reduce biases in social work. Their research lays the foundation for tools that support more respectful and informed practice. And we think back on the story, that situation could have been handled differently had the intern challenged knowing about his bias and challenged his bias, because the guy, the patient, he never seen us again. And if we address our biases, uh, it won't happen again, and we can move forward to broaden our awareness, make sure we care, and we make sure we make a strong commitment to do better. And I thank you.